And joining us today on the Book Talk segment of the show, great pleasure to welcome one of the co-authors of a very interesting book, and I know it's going to get a lot of great information to folks. It's called When Doctors Don't Listen, How to Avoid Misdiagnoses and Unnecessary Tests. We're joined by Dr. Leana Wen today. She's an emergency physician up in Brigham and Women's Massachusetts General Hospital, and she joined us by telephone today. Doctor, thanks for joining us. How are you?
I'm well. How are you doing?
I'm doing great. Is that right? You're an emergency physician?
I am. I practice emergency medicine here in Boston and see a lot of patients from all walks of life.
I was going to say, there used to be a show on TV, I don't know if you ever watched it, St. Elsewhere, about a hospital in Boston. Did you ever see that show?
I did, yes.
And that looked like it was pretty wild. My mother was actually a nurse up in Boston, so she told me a lot of great stories of working in the ER and operating rooms. So you see something, just about everything, I guess, in that field, don't you?
That's right. We do see every day in a very short period of time as well, and that's actually what led me to write When Doctors Don't Listen, because I saw so many patients who were dissatisfied and frustrated by their experiences in medicine.
It really has become a hot topic now with all the changes coming up, already have undergone in healthcare, the costs and all that, and I guess people are becoming more frustrated just going to the doctor for a regular visit. The limited time you do have with your doctor. I guess they've told you, right, that they don't know what to do sometimes.
That's right, and that there is, as you said, such little time, but as a result, doctors begin to cut corners, and instead of listening to the patient, they begin to just use checklists and algorithms and recipes that are not personalized to the individual.
Is that the biggest complaint that you hear, that my doctor doesn't listen to me?
Yeah, that my doctor doesn't listen, but unfortunately this then translates not just to not listening and not feeling well because of that, but because it leads to misdiagnosis. So we know that 80% of diagnoses can be made based on just your history, the story of why you came in. So if your doctor never listened to you, then how could you be sure that you're getting the right diagnosis? And most of the time, that diagnosis could actually be wrong because of the lack of listening, lack of attention to your story.
Yeah, you brought up a point, and just reading through your book, you talk about almost a checklist that doctors use. They hear maybe the first word you say to your mouth, the symptom, and then automatic cookbook, I guess I should say is the term you use, that goes right to that symptom, and then, that's a cure. But you may have other things on top of it that may make that particular cure completely wrong for you, right?
Right, and patients are surprised when they learn that the average time to interruption when you begin talking to your doctor is something like 10 seconds. That means that you really have just 10 seconds to get whatever point across, because otherwise your doctor is going to interrupt you and focus on one thing that you said. And so knowing that, that's why my book, When Doctors Don't Listen, gives you tips for what to do to make sure that your story is heard, to make sure that your doctor actually gets to your right diagnosis.
Yeah, what should you do? I mean, I've been through it. I guess everybody that's been to a doctor now goes through that. You wait in the big room, and then you get called into the smaller waiting room, and you kind of have that anxiety. When's he going to walk in? And when he finally does, you feel a little quite flustered, and you probably don't say properly what you should, or at least explain your problem, and then you feel a little intimidated. So I guess all that adds up, doesn't it?
Very good point, actually. So you made two excellent points. The first is that in the moment, it's really hard to be your best advocate, right? I mean, you may already not be feeling well, and on top of that, you are feeling intimidated. There are lots of reasons why it's hard to get your story across then. So that's why practicing is so important. I encourage my patients to write down their symptoms, practice that rehearsal. You can imagine that if you're going to speak to your boss or your senator and you only have 10 seconds to get your point across, you really have to practice it. So why not practice it in advance of going to the doctor? And related to this too, so practicing it, I think it's really important. And being an empowered patient, it's not something that's so intuitive, right? You said yourself that it's easy to feel intimidated because that's not the way that we've been trained to understand medical care. And so that's why it's so important to practice even on an everyday basis. And that's why the book contains a lot of tips on how to become empowered in your everyday interactions.
You have 8 pillars to better diagnosis. That's what you term them as, and just a couple we'll go through. Like you just said, tell your whole story, even if your doctor is steering you away from from the narrative. Like I said, I guess you just have to make sure you get it all out, even if it's only in 10 seconds, because you may hear something and then not listen to the rest of your story.
Right, and so practice summarizing your story first, and to say the most high-impact things first. So, for example, if you've had a bad headache, instead of just saying, oh, how are you, how's the weather, don't talk about pleasantries. Say, I have a terrible headache. It was so bad that I couldn't go to work for 3 days. I mean, that will get the doctor's attention. So that's what I mean by telling the story.
Have you found, doctor, or have you heard in medical school, are they trying to add this as part of the curriculum for doctors? I mean, I know doctors are very busy, and all the training you have to go through, it's difficult, but I guess that is a big important part of it is either bedside manner or office etiquette, right? You have to learn how to deal. I mean, it's a customer service position on top of being a physician.
You're absolutely right, Doug. And actually, the most helpful would be for doctors to improve. I mean, some people will ask me, what's the point of having patients do this work, right? I mean, shouldn't doctors be the professionals? Shouldn't they be in charge of doing the work? And I'd say absolutely. And I know that medical schools are getting better. I teach at Harvard Medical School, and medical education is something that's very important to me because I do think that the key is to make sure the next generation is better and does the right thing by our patients. But in the meantime, I think it's also important for patients to be on board and for patients to do the right thing too and to empower yourself to get the best care possible.
How challenging is it, doctor, now? I mean, you see so many things in the ER. I guess that gives you a little bit of a leg up in a sense. You see so many different types of problems, but maybe if you're just a regular pediatrician or a regular GP doctor, you may not see quite as much as you do, so their diagnostic skills may not be as, I wouldn't say as good, but maybe they haven't seen as much as you. So that's a whole other thing, isn't it?
Oh, interesting that you mentioned that. I used to think that GPs and pediatricians, people in primary care in general, see a ton. That primary care, just like emergency medicine, is one of the most challenging, if not the most challenging field, because you really do have to understand everything. When somebody comes to you and you're a specialist, you kind of already know what's going on with them. And yet when they come to you without knowing any of their past history, without knowing their the other things that brought them in, that's actually quite challenging. So really, all doctors can benefit from this book, but also all patients, no matter which kind of doctor you're going to, your specialist or the ER doctor or your primary care doctor, you should make sure that you get empowered and advocate for your care with whoever you see.
And you always have the option, if you can, obviously if it's an emergency, you get to the hospital no matter how you can, but if you can bring somebody with you, a family member or a friend, I mean, that's an idea that they can help you talk to the doctor. Is that recommended?
I agree 100%. So especially if you're not feeling well, you don't really want to be thinking about, well, how do I tell my story and what are the questions to ask? I mean, even if you just have the flu, you feel pretty bad. And so having someone there with you is really important. But I would go one step further and say that even if you're going to a routine appointment, it helps to have an advocate with you. Just because if you don't remember the questions to ask, that person can help to remind you and serve as your advocate when it comes to your health care.
Yeah, good idea. Not as a political question now, but doctor, with all the changes upcoming, some are already in place and some will be in place the next year or so with the whole healthcare situation. Are you optimistic that it's going to be okay? I know a lot of people are nervous about it, particularly even in your profession. Doctors are, I guess, nervous about it too, right?
I'm an optimistic person, so the answer is yes, I am optimistic that things are going to get better, but I think it will take quite a while. I don't think the changes are going to be enacted as quickly as we think, and by the time that they actually have an impact on you as the individual patient, it's going to be years down the line. And that's actually why I wrote When Doctors Don't Listen, to say that you can't wait until healthcare reform happens. You can't wait until your doctor gets better. You have to take matters into your own hands now and get the best care you can for yourself and your loved ones and your parents and your children and so forth.
The name of the book is When Doctors Don't Listen, How to Avoid Misdiagnoses and Unnecessary Tests. We've been talking with Dr. Leana Wen today. Leana, pleasure to have a few minutes. Appreciate you taking the time. I know you're working in the ER. You don't probably have a lot of downtime, but thank you for writing the book. I know our listeners are going to enjoy reading it. Give out a website and we get a hold of it.
Sure. So the website for the book is WhenDoctorsDon'tListen.com. You can purchase When Doctors Don't Listen on Amazon.com and also on BarnesandNoble.com and at your local bookstore. And I really do hope that all of you will be willing to read the book and take the next step to transform your healthcare.
Great, Doctor. Great information, and thank you for all great work you do up in Boston. I hope we can talk to you again sometime.
Absolutely. Thank you so much, Doug.